Let me sum up what have been discussed before and share our experience of technological and regulatory opportunities and risks in clinical practice. Many people have said that clearly defined technologies and standards allow us to get reliable data, to present them to the medical community, and to have a very effective dialogue with the regulator. The design of regulatory trials, and we take very many methodological approaches from regulatory agencies. We discuss them with regulatory agencies, and that's how we move towards RWE. I would like to share our experience 3 days ago in a medical journal. Medicine was published our results of our trial. The trial was conducted very well and presented to the medical community, and so that was about RWD, but the same way is used for RWE. I will tell you what dialogues we conduct with agencies and our next purpose, our next goal will be just to say that our first trial on RWE was also published in the medicine journal. Of course, we publish all our results in Russian journals as well. So regulatory news in the Russian Federation are very important. What is important? Now we have in the Euro-Asian Economic Union the terms of RWD and RWE. They have become part of the decision number 78 of the Euro-Asian Economic Union. And it had been used to extend the number of trials that would be held in this respect. So the question is how to expand the field of their application, the field of application of these trials and include clinical practice. A lot has been said about European EMA, and from the regulatory point of view, the data has been included in the registration of drugs. Focus is on the quality of data on the basis of local consensuses, and there are very many parallel patterns in EMA and Euro-Asian Economic Union, and we can think how we can introduce them locally. And it is interesting to note Darwin EU, a large project where they process data. It is a service for regulatory experts that they can use to solve some financial issues. Also, we may speak about FDA. They released several new guides. Again, from the field of introduction, they have come over to the assurance of quality. And here you see the guides. 3 guides have become final documents. It is very, when you are getting ready for the dialogue, you should know all these innovations. Now, as to RWE 2022, we speak about the acceptance and use of data. EMA continues to go in the direction of data-driven regulation. In September 2022, they launched a pilot project on the access of the regulator to the raw, crude electronic data about patients for registration and observational trials. I will speak about our experience in this field, about getting data about hepatitis and HIV trials. And there are more and more new trials confirming the comparability of data received in RWE and in the previous registration trials. It's important for getting an overall bulk of data and using them in regulatory dialogue. As to methodology, of course, it is important to break down data, to make, for example, EMA has made up a catalog of metadata. And the quality of data is, of course, of great importance. As to problems and prospects, so a lot has been said about it today. So what is of most interest as press is, first of all, integration of various databases and regulator, and the regulatory requirements for data, their collection and the storage. And there are a lot of, some data are structured, some others are not. And there are a lot of questions to non-structured data. There is a lot of suspicions about non-structured data. That's why the data is to be structured properly. In conclusion, the most interesting thing, this is the design of the observational trial. It started right on the eve of the COVID in 2020. This is an observational and prospective trial to assess the combination of therapy in patients with hepatitis and COVID. You know that standard approaches cannot be used to assess the co-efficacy of different co-efficacy of different drugs. And here you see that the patients with the viral hepatitis C of genotype 1 and with COVID were under investigation. So understanding that co-infection is a huge problem in Russia. There are very many patients with the damaged liver function, and we need a large number of patients. So this trial was initiated, and you see, we estimate we had about 1,150 patients. In 2023, we will elect more patients up to 2,000. We need a large number of patients, and there was an online and offline monitoring of patients, paying attention to the laboratory tests and trying to make the data structured. So the results were reported at the leading symposium of White Nights on hepatology, and the first part of the trial you see on the slide. We see that the response, the efficacy of therapy confirmed what we had received in the registration trial, which is important. It also confirmed that the main points of efficacy were proved by laboratory tests. It is a very these are very objectivized data. And the response was long-term, and we continue confirming our data. This is a logical, continuous trial confirming what has the facts received, the results received in the registration trial. But we had a larger group of patients. Thank you very much for your attention. I will be happy to answer your questions.